Hi guys, this video is going to be all about the questions and answers that I prepared for my recent paediatric nursing interview. So if you guys saw my last video, you know that I went through the 6 questions that they actually asked me in the interview, but obviously before the interview I prepared many questions, about 16 or 17 questions that they could have asked me but didn't. And I kind of just thought it would be helpful to really quickly go through those, just so that you kind of have an idea of, if you have an interview, what to prepare, what questions to think about and how to answer them. So the first thing that I got down is tell us about yourself. Now this is a question that's quite common and can trip quite a few people up. So they don't want you to say, oh, my name's Natasha, I'm 28 years old. They want to actually hear information about you that's really relevant to the post. So the way I would have answered that question is, I've been a qualified paediatric nurse for 6 years, but I made the decision to be at home when I have my children. So for the last 3 years I've been at home caring for them, and I've just made the decision now to come back into nursing. I have over 11 years experience working with children, and I have a particular interest in respiratory medicine and complex care. The next questions that I thought that they might ask was, what have you done to keep up to date? I particularly thought that they might ask this knowing that I'd been out of nursing for 3 years, and I was quite surprised they didn't. But keeping up to date was a concern that I've had for the last couple of months, as I know that I've been wanting to go back into nursing. So I actually subscribe to the RCNI Nursing Children Young People magazine and online digital pack and modules, and there are lots of CBD things and modules that you can do on there to kind of update your practice. So I just had a list of stuff that modules that I'd recently done and articles that I'd recently read. I also, after these modules and articles, did reflective pieces of writing, so I kind of had that to talk about as well, and kind of how helpful I found the modules in terms of giving me confidence to know that I do actually have that knowledge, but also confidence to know that in areas where my knowledge was lacking, I have been able to gain that knowledge now, and that I'm more confident to kind of go into nursing after the break. Next question was, what are your weaknesses? This is quite a common question, and actually a question that people really struggle to answer, and a very difficult question for me to talk to you about how to answer, because obviously it's different for everybody. The key thing is not to give them a weakness that's just a weakness, but a weakness that you can kind of turn into a positive or say something positive about. So I actually kind of had 2 main weaknesses that I thought I'd discuss if they asked me that question. One being that I was out of nursing for the last 3 years, which I've discussed already. And the main things I would have said around that was that I kind of have fear and a bit of lack of confidence about forgetting things. So I could draw into that the fact that I've been doing all these things that I've been doing to keep up to date. The other weakness that I had prepared was that my only experience of nursing has been in London. I trained in London, I lived in London, I worked in London for my whole nursing as a student nurse and as a qualified nurse, so coming into a more rural setting was something that I was going to have to get used to, and I wasn't sure if things would be done a little bit differently, that we'd see different things. On the flip side, what are your strengths? Now some people find that really hard to answer as well, I think, especially if you're a newly qualified nurse, but you should have received feedback from other people, and that's a really good place to start, because you can even then just say that you know, my manager said this about me, or my colleague said this about me, or a fellow student said something, or a university lecturer said something. You would have had in your 3 years of training, or in the time that you're qualified, someone say something positive about your nursing experience. And I think it's really good to mention something that somebody else has said, or a family member has said to me before, that my child is calm with you and really likes you. And so I was able kind of to say, I would be able to say to that question that I'm really good at building relationships with children and their families, and I think I get along with children and their families really well, and I'm able to calm a distressed child. And I could use the example of that particular patient, that particular parent, and what they said. And kind of coming on to that was, how would you deal with a distressed child? So I had that same example in my mind that I would have then spoken about. I would have also answered that question from a paediatric perspective in terms of getting the family involved, because the best people honestly to calm down a child is their mum, their dad, their sibling or auntie or friend or whoever is there with them. I also would have talked a little bit about singing and distraction, because I like to sing to the children while I'm doing procedures and while they're kind of doing OBS or whatever, and distract them with different toys and things like that I have on me. It's also a great question to bring in the multidisciplinary team, because obviously you have play specialists and healthcare assistants, or you might just have a particular member of staff that a child gets on really well with that you can kind of bring into that situation. I think you can kind of see that it's developing a theme here, that sometimes the best way to answer questions isn't just this academic answer, but actually examples of how you've done that in practice, so that they can kind of see that you're experienced, that you know what you're talking about. Another very common question that I prepared were, what are the signs of abuse, or what action would you take? And I kind of talked a little bit about that in my last video, because they did ask me if I was concerned about a child, what would I do? So every single nurse should kind of know the basic symptoms or signs of abuse. Particularly physical abuse is much easier to recognise, because you obviously have bruising, biting, fractures maybe. But then you also have things like neglect with poor weight gain. You might have really terrible nappy rash if a parent isn't changing nappy as often as they should have. You also have emotional and psychological signs of abuse, such as being withdrawn, being depressed, self-harm in slightly older children. And what action you would take is what I talked about last time. You would document, you would tell the nurse in charge, you would tell the safeguarding lead. The other question I thought about was home advice for different kind of illnesses. So sometimes they would say, what going home advice would you give to a parent who is taking their child home with bronchiolitis, with type 1 diabetes, with diarrhea and vomiting? So it's just kind of, as a nurse, you kind of should know that stuff. So it's just thinking about that, jotting a few things down so you're not kind of stuck and struggle with that question. It might also be not even going home advice, just advice that you'd give on the ward to a mum who comes in with a child with dehydration from diarrhea and vomiting, or with bronchiolitis, or with diabetes, poorly controlled diabetes and things like that. They just want you to know that you know, as a nurse, the kind of public health education that you should be given to parents. I also thought a bit about the key issues affecting the specific area in the UK that we're at. Wherever you are, there might be particular issues that you don't necessarily have in other places of the country. So again, I just did a bit of research. The RCM was quite good at that. Quite an easy question at the moment because of COVID, and that's pretty much affecting everywhere. But I also read an article about how COVID is affecting paediatric nursing, so I had some specifics on what to say in terms of changes to kind of outpatient home visiting community nursing. And there are obviously quite a bit of safeguarding concerns at the moment in paediatric nursing, with children not being seen by social services, not being seen at school, and being kind of isolated in their homes, and social workers not being able to go out and do their normal visits. But it's something for you to think about in your local area. There might be news sites, there might be the magazines and things that you can look at, there might be things on the Trust website. Next one is how I would deal with an aggressive parent or patient. So there's kind of a tick box answer to this one. You kind of stay calm, you're friendly, you don't use any kind of aggressive body language or tone of voice, you keep your voice calm. And it kind of sounds obvious, but it's quite hard to do in the time. So again, if you have examples of that, it's really good to tell an example. Most nurses, even as a student nurse, you have an example of that. It's quite a highly kind of stressed environment, and you do get just kind of aggressive parents and patients quite often. And it's just about being non-confrontational. It's also about really understanding and empathizing how that parent's feeling. They have a child in hospital, and they're stressed and they're tired and they're worried themselves. I also said that I think smiling is the key. I think you can get a lot done with a smile, and a parent or a patient finds it very difficult to be aggressive to a nurse who's being overly kind and friendly and smiling and polite. They then just feel so bad that they actually can't shout at you, and they can't kind of become aggressive, and it really calms down the situation. Next question I prepared was how to prevent burnout. They kind of asked me this in terms of how would you manage your stress. So I kind of answered this in the last video as well, but I kind of said that, again, that looks different for everyone. You've got to know your limits. You've got to talk about it with either your family or friends, have someone that you can really confide in, but also being able to talk to your managers and superiors about times that you're feeling stressed and you're feeling exhausted. And I actually had an example of that, because I actually took a month off work in my second year after I qualified, because I was just burnt out. Basically, I was absolutely exhausted, and you know, I know my own limits, and my limits aren't what other people's limits are. So for example, one of my limits is that I can't do night shifts. Night shifts do me in. I'm absolutely exhausted. I can't. They really affect my mental health. They really affect my physical health. I lost a lot of weight when I was kind of, at the time I didn't really know it was night shifts, but after taking a month off and then going back on days, I realised that it was night shifts that I couldn't do. I realised the time in my life that I'm at now with 2 small children, and it's just kind of knowing yourself and knowing what you are able to do. It's one of the reasons that I've decided to go back as bank and not as permanent full-time staff, because I have 2 small young children. My husband is doing a course this year, and it would just be too much to kind of be expected to be in work all the time, and I wanted that flexibility with bank. Next question was, what are the most important things about team working? Again, another tick box answer in a way. They kind of want you to know that communication is really key. I also said that it needs to be supportive and friendly, and you need to kind of have good relationships in good times, so that in tough times and stressful situations, that relationship's still good and maintained. It's also just having an understanding of what nursing is like, so kind of saying that nursing's really exhausting, really challenging, stressful profession at times, and how important it is to kind of have your members of team as kind of your support system, because as much as my family and my friends' support system, they can never know what I do at work. They don't understand, they just don't get it, and so it's really important to kind of have your team there for you and to communicate well with them and to be friendly and to kind of help each other out as well. If I'm really busy and you know, I need help, I want to be able to ask for help, and vice versa. If I have got a bit of free time and I can see my colleague is really busy, I need to be able to help her out. It's just helping each other out, communicating well, being friendly, being kind, being generous with your time. And yeah, they just want to see that you will fit into their team really well. Time's marching on, so I'm going to try and get through the last ones really quickly. What would you do in an emergency situation? Again, it's just about knowing the steps you would take in an emergency situation. Call for help, multidisciplinary team, staying calm. Again, communication is really key in those situations. Everyone needs to have a role and know what they're doing. Again, giving an example of this, I was in a resuscitation situation at a hospital I worked at, and everyone had a particular role. One nurse for the airway, one nurse for the compressions, one nurse for the medication, one nurse as a scribe, one nurse as a runner to get whatever you needed to get that was elsewhere on the ward, one nurse in charge of the emergency trolley to pass stuff to, and things like that, and it worked really well. So again, using examples of where it's worked well is really good. And also someone to stay with the family and reassure them. It's really important in those situations not just to leave family members to it and just to watch, or to kind of just leave them not knowing what's going to happen. There's also should be someone in charge of taking care of them. What drew you to nursing? Again, they kind of don't want you to say, I've said this before, they don't want you to say, oh, I just love children and I love caring for people and stuff like that. They kind of want you to talk about specifics that are relevant to you that they might not hear from other people. So for me, it was kind of specific things in work experience. I had a teacher who became a teacher but was a nurse first, and she really influenced me to go into nursing. Also my love of science and things like respiratory medicine. Also my family experiences influenced me in kind of the career that I took. What qualities make an ideal paediatric nurse? Again, I talked about communication, I talked about being kind and empathetic. It's really important to kind of be able to understand where a family's coming from and understand that they have a sick child in hospital and how stressful and upsetting and worrying that is for a family, and being able to communicate well with them in that situation. And knowledge and being able to keep up to date and have evidence-based knowledge, really essential, because as much as you need to be that kind person who can communicate well, you need to know what you're doing as well. The kind of penultimate thing that I thought about was, why do you want this job? So again, it's really personal to you, but you apply for that job, so you just need to think about why you wanted that job, why you wanted to apply for it. Quite often nursing jobs give you a specific experience that your job where you're at or after you're a student is kind of what you're looking for. So for example, if you're going into a general nursing job straight out of university, you might say, I just really thought that going into a general nursing job straight out of university would be the best place for me to really get to know my general nursing, to get to have general nursing knowledge and general nursing experience. If you're going into a specialist ward, you might say I have a specific interest in that area and why you have a specific interest in that area. For me, I said that I really missed nursing in the 3 years that I've been absent, that I love the excitement of it and I love the families and I really miss the particular patient and family interaction the most. And I also just love learning and love developing, and I feel like for the last 3 years it's really been missing from my life, this kind of evidence-based practice, reading articles, doing modules, kind of developing my knowledge and working as a professional. I've just really felt this kind of gap in my life where I haven't been able to do that. The other things that I just jotted down at the bottom of my page were the 6 C's of nursing, because even though we should know them in the moment when you're nervous for an interview, it's so easy to forget them. So I just jotted them down on my paper so I could quickly glance in case they asked me that. And I also jotted down the trust's values and mission statement and things like that, because I just wanted that there so that I didn't forget it as well. And then the last thing that I said that I think, again, is in my last video was about questions to ask. Again, it's really, really essential that you ask questions. I'll really quickly just say the questions that I had, because I don't want to go on I've already gone on too long, and I also said this in my last video, so you can check that out as well, because I go into a bit more detail there. So I said, I asked about the fact that I've been out of nursing for 3 years and kind of what support I would have and training and things like that. I asked in relation to that how much bank staff are able to access the training that the trust provides. I also asked if you could pick 3 words to describe the paediatric unit or sentences, how would you describe it? And that gave me a really good insight into what the unit would be like, and also kind of impressed them with that question as well. So I hope that was helpful. I'm really sorry it's been so long. I'll try and cut it as much as I can, but I hope it was helpful, and I'll see you in my next video, guys. Bye.